Cindy. I'm here to be discussing a 50-year-old client who wishes to use exercise to help relieve menopausal symptoms. So, menopause is simply the absence of menstrual period for a consecutive period of 12 months. Usually, the average age in women is 51. Signs of symptoms include hot flashes, night sweats, moodiness, weight gain, depression, anxiety, sleep disorders, osteoporosis, and cardiovascular disease. With the reduction in estrogen, it also does affect a woman's metabolic rate, which is just the rate that the body converts stored energy into useful working energy. There are many benefits of exercising during menopause. Regular exercise can help prevent osteoporosis, especially with weight-bearing exercises, as well as help to prevent cardiovascular disease and mental health. Exercise also can help reduce stress, increase bone mass, and decrease the risk of high blood pressure, heart attacks, and strokes. Exercise can also help with weight management issues. Women experience a rapid bone loss after menopause. Therefore, strength training is beneficial for them, as well as weight-bearing exercises and cardio and flexibility balance. Strength training should be performed 2 to 3 times per week. Training helps muscles build mass, which helps to maintain bone mass and helps to increase the metabolism. Flexibility and balance training is also beneficial to help protect women from falling as they age. A minimum of 30 minutes of cardiovascular exercise should be performed most days of the week. As well, some pelvic floor exercises to strengthen up the pelvic floor muscles. As we age, our pelvic floor muscles loosen. So before commencing an exercise program with this lady, I would recommend a few assessments. Firstly, I would do weight and height in kilograms and height in centimeters, and from that I would be able to figure out her BMI. Secondly, I would do a resting heart rate blood pressure, so I'll do that now. And unfortunately, I don't have a willing volunteer at the moment to help me with this, so I'm just going to demonstrate on myself. So we want the tubing to be on the inside and just up a couple of centimeters from the elbow joint. I'm using a automatic. So it's 113 over 82 is my resting blood pressure, and my heart rate is at 69. So both of those are in the normal range, which is fantastic. Of course, it goes on the left arm, and we don't talk while we're doing that assessment. Normally I would do it twice, but for this demo, I'm just going to do it one time. Next, I would do a strength test. So with the hand dynamometer, I would just bring it into the right hand and standing straight with it, hands away from the body, not touching, numbers facing away, a big inhale, and on the end of the exhale, I'm going to squeeze and hold. Okay, 50, and then I'll switch and do the same thing on the left hand. 50 again, and then I would go back and do a second trial on the right and the left side. Just measuring the strength, grip strength. Okay, and then also I would want to do upper body strength and endurance, so I would grab a mat and just have my client do a push-up test. Now, being a woman, I would recommend going from the knees hands wide, and we're just going to keep our head in line with our spine, and we're going to do as many push-ups as we can until our form breaks down. So I'm not sure you can see this on the camera, but I'll do a few hands wide and just down and out as many as we can. That's the push-up test. And then I would do balance, single leg balance. As we age, we want to maintain strong core and balance so that we don't slip and fall and potentially fracture our already weakening muscles and bones. All right, so then I would just cross the hands across the chest and then one leg up to a maximum of 45 seconds until our form breaks down. I'm not going to do the full test, but you get the idea, and then we'll switch, do the same thing on the other side, and then we will repeat both sides with the eyes closed. Now, the next test I would do is a flexibility test. We want to remain flexible as we age, so I would just have my client sit down on the floor, do a couple of hurdler stretches, shoes off. So just sitting down, bending one knee, reaching for the toes, sitting tall. I'll do a couple, so big breath in, sitting tall, big exhale and hold. And just stretch, get those muscles warmed up. And same thing on the other leg, reach for the toes. And reach for the toes. And then when they're ready, feet flat against the wall, sitting up nice and straight, crossing one hand over top of the other, and just sliding the hands in front as far as possible. And then we'll do that 2 times. Okay, the second one's a little better. So that's the flexibility test. And then I would probably have my client do a cardio test. I would like to see her try the MCAFT stair test, just because it's a little bit more weight bearing. I don't have that equipment here, but it's just up and down the stairs following the MCAFT assessment procedure. So that's it for my assessments for my menopausal 50-year-old client.